The treatment of SARS is really difficult because it's still a relatively new disease and not a whole lot is known about it. Not a lot of drug development has occurred, and especially during the time of the breakout, they were just using best guessed rationales that didn't have a ton of supportive data. So they started with a combination of antiviral agents and corticosteroids. The most common antiviral agent used was ribavirin. Towards the end of the breakout in Hong Kong, up to 90% of the patients were being given that. And they paired it frequently with corticosteroids to kind of deal with the cytokine inflammation storm that happened with the onset of the virus. And then the ribavirin kind of helped deal with the viral bloom that happened from the steroid use, because as we know, the steroids tamp down the immune system. So then that kind of helps the virus flourish, and then you have to have something to tamp the virus back down or slow it down again. Another thing they tried was convalescent plasma, which is where donated plasma from people who had recovered from SARS was given to patients who were really struggling to recover, and with the hope that some of that passive immunity would be transferred along. Again, this helped to kind of shorten hospital stays for some people, but there wasn't a ton of overwhelmingly positive data that this was super helpful either. And then they just continued to kind of go down the line and see what they could get to work for people, especially as they declined. They did immunoglobulin for people who stopped responding well to the corticosteroids to get the inflammation under control. But there's negative side effects to that, like blood clots. And then as far as just being able to breathe and keeping your oxygen saturation good, they would start with the non-invasive pressure ventilation, which is the fitted pressurized mask. And then if you continue to tank, they would intubate you and move on to the invasive mechanical ventilation. And of course, people were trying the novel treatment approaches like Chinese medicine as well.